Assalamu alaikum. I'm Abdullah, a 20 years old medical student from Egypt, and I'm studying at the University of Davila in Bucharest, Romania. So I'm going from the first year to the second year, and today I'm going to talk to you about my medical and educational activities for the first year. And for my activities before I got 19, you can click on that video. First of all, the medical activities. At the beginning of the school year in October 2013, I attended the SNN conference at the University of Davila, and it was organized by the National Society of Neuroscience in Romania, and the conference was pretty interesting and full of information about neurology and neuroscience, so here are some pictures. Right after this conference, I applied for the interview for the membership of the research team at the university, and I got accepted. This research team is a part of an international research network called COMA-AEG that works on gathering neuroscientists, clinicians, and engineers who work on the improvement of the neurophysiological imaging of the brain, especially for unconscious patients, so patients who are in a coma. So the topic is pretty interesting and the research team is really good. Then, in November 2013, I participated in a medical students conference in Craiova, Romania, which was called CIMSC. And in this conference I made a presentation with the title of Management of Alzheimer's Disease Using Neural Cell Transplants Literature Review. And for that presentation I got a mention, which was like a 4th position. So here's a preview. So the study objectives. We reviewed the current available neural transplants or operations that are related to the cognitive impairment caused by the induced neurodegeneration of Alzheimer's disease. And this is more kind of diagnostic because it's all preclinical. This is not conducted clinically yet. Also, in the same conference, I was a co-author in 2 other literature reviews, one of them called Management of Amyotrophic Lateral Sclerosis, ALS, and the other one was called Neurological Complications After Cardiac Surgery. So I made 2 videos to summarize what each presentation was talking about, and here's a part of each. The sporadic type accounts for 90% of the cases diagnosed with ALS. Familial means that it's due to family history. For the minimally invasive surgery, it opens a much smaller opening compared to that, and also the cardiac pulmonary bypass goes here. Also, in the same conference, I attended a workshop which was called First Aid Basic Airway Management. So it was dealing with how to perform CPR on an adult or a child in case of an accident or so. So here's a part of it. And you keep on repeating this procedure until the patient wakes up or emergency arrives. Making the pushes on the sternum, you just use your left hand, as we can see. And you also do it 30 times. Then, in December 2013, I joined another medical students conference in Bucharest, Romania, which was called CNSTM, and there I made a presentation with the title Alzheimer's Disease Mental State Rating Scales Literature Review. So it was talking about the rating scales which are used to assess the severity of Alzheimer's disease in dementia patients. So here is a preview. Mental state rating scales that are included in the study can be categorized into 2 main categories. One of them is patient-based and the other one is clinician-based. So for the patient-based, they are based on assessing the cognitive or the mental state of the patient, and these are Alzheimer's disease assessment scale, the mini mental state exam, and the clock drawing test. And in the same conference, I was a co-author in a literature review called The Correlation Between Brain Injury and the Elevation of S100B Marker After Cardiac Pulmonary Bypass. And I also made a video explaining what this presentation was about, and here's a part of it. So the blood, the deoxygenated blood, goes inside the machine. The machine oxygenates the blood, and it goes back to the heart. And in the same conference, I attended 2 workshops organized by SSCR, which is the Surgical Society for Medical Students in Romania. One of them was about vascular surgery skills, and the other one was about mini-digestive surgery skills. And I made 2 videos for those workshops, so here's a little bit of each. You could get inside the vessel, and when you finish, it could be a cause of thrombosis or something inside the vessel. So it's safer to remove the fatty tissue first and then work on the vessel. Clean the outside, then inside, like from here, and goes all the way from inside to outside, and then from outside to inside, inside to outside, and so on. And it goes all the way like this. Then in the next year, in March 2014, there was the Brain Awareness Week. This is a global campaign in which the awareness about the progress and advancement in the brain research is raised. So I made a presentation called Acupuncture and Alzheimer's Disease Treatment Literature Review. So here's a little bit of it. And these are some of the points that were used in these studies. As we can see, throughout the leg, in the hand, at the ankle, at the dorsal side of the foot, and at the dorsal side of the hand. Right after this presentation, I became a member of SOMS, which is the Scientific Organization for Medical Students in the University of Davila in Bucharest, Romania. And this is their website. And then in April, at the beginning of April, there was another medical students conference in Iași, in Romania, called Congresses. And there I made a presentation with the title, The Effect of Insulin on the Cognitive Function of Alzheimer's Disease Patients. So it was talking about using insulin as a treatment for Alzheimer's disease. So here is a preview. In the nasal serous glands, and then is transported to the brain through the blood-brain barrier. And this barrier protects the brain and facilitates the transportation of the therapy throughout the central nervous system. And we can see here the purple proteins are actually parts of the blood-brain barrier. Later in April, there was another medical students conference in Timișoara, Romania, and there I made a presentation called Omega-3 Fatty Acids and the Treatment of Alzheimer's Disease Literature Review. So for that presentation, I was also awarded a mention. So here is a preview. 13. Here is a very important point, so that the treatment was conducted in patients with the apolipoprotein E4 allele. 6 of them were positive and 34 were negative. And it would notice that the result of the action of the omega-3 fatty acid is different according to the allele. So if it was positive, 31% more, the mean plasma levels of the omega-3 fatty acid in the blood were 31% more than the negative species. Also, in the same conference, I attended a workshop organized by the Society of Medical Students in Timișoara, SSMT, and the workshop was called Hands-on Abdominal Echography. So it was dealing with how to perform an abdominal echography and recognize the organs in the abdominal area like the liver, the spleen, the stomach, and so on. And I also made a video about that workshop, so here's a part of it. that will be reflected like this until they reach the sound source once again. That lets you control the software of the sonogram so that you can apply some filters or measure certain distances on the picture itself. Then at the end of April, I participated in FAME Lab 2014 in Romania, and I made a very short presentation of about 3 minutes in Romanian about the possibility of transplanting a memory chip in the brains of dementia patients. And here's the preview.
Hipocampul a fost lezat. După aceea, proteza a fost implantat în locul cu campul lezat și există două chipuri, una pentru QA 1 și alta pentru QA 3. QA se înseamnă cortical area, zona creierului. Și de fapt, acest proteză a avut rezultate foarte bine.
Then in May 2014, I attended a workshop also organized by SSCR. It was called Knots and Sutures 5th edition. It was very good. It was talking about basic surgical instruments, wound care and dressing, principles of asepsis and antisepsis, basic knots and basic sutures, and so on. So here are some pictures. And this sums it up for the medical activities. As for the educational activities, in this channel video for free, I've been making high school subjects tutorials since I was 16 years old, and I'm still making these tutorials. Also this year I started making tutorials about medical curriculum like anatomy, physiology, biochemistry, and so on. So you can click on any of these playlists in order to see their videos. And so this is it. I hope you enjoyed the video. Don't forget to subscribe, and see you next time.